Welcome to Module 4. You're halfway done. We are going over the appearance of structures on ultrasound.
Upon completion of this module, the student will be able to understand the characteristics of different structures when viewing them on ultrasound, explain the reasoning behind the variability in the appearances of different structures, and differentiate between various tissues and structures while performing real-time ultrasound. We're going to start out by looking at some physics. Don't let this freak you out. Don't memorize this table. Just look at the trends. It assists in understanding the echogenicity of various tissues, reflection and refraction of ultrasound waves, and the formation of ultrasound artifacts. The first thing that we're going to talk about is density. So, of course, air is going to be the least dense, followed by fat, blood, liver, and bone is going to be the most dense. The main points I want you to understand are refraction, attenuation, and reflection. Refraction is when ultrasound waves travel through tissue and meet another tissue with a slightly different impedance value, and the speed changes somewhat, and it causes the ultrasound waves to change direction. So this change in direction is called refraction. And you can kind of see these values on this column right here. So when you're going from one structure to another, say, air to bone, that's why we can use the ultrasound gel to make sure that you don't get a lot of this refraction. Now we're going to talk about attenuation, which is in the last column right here. It describes how rapidly a medium reduces the intensity of an ultrasound wave as it passes through it. So the two mediums with the highest amounts of attenuation are air and bone. This is the reason that ultrasound waves can't pass through air or bone. The ultrasound waves either get reflected back or they get absorbed. So attenuation also accounts for the shadowing artifacts that can be seen in bone or gallstones that we talked about in Module 3. Reflection, this is why bone and air appear as bright lines on ultrasound, and also why you get the reverberation or reflection A lines that we talked about with the pulmonary ultrasound. There is such a large difference between the impedance of tissue and bone or air that they will cause almost all of the ultrasound waves to reflect back instead of penetrating through. What is interesting is these values both cause reflection because of the drastic differences in the impedance of soft tissue. So air is extremely low and bone is extremely high, and so the difference with soft tissue is approximately like in the middle. So you get this kind of imbalance between all of these, and it can cause artifacts, reflection, refraction, and the different echogenicities of various tissues. Now that we have some of the physics out of the way, I just have kind of the different structures on ultrasound and how they look. This is just an example of each one, so I'll give you a little bit to look at it. But here's muscle right here, bone, this structure, fluid all in here. Here's a nerve right there, tendon. And then this is bone, and here's the ligament in between. First, we're going to go over bone. So bone has a very hyperechoic, bright cortical edge with a dark area deep to it. There's significant acoustic impedance mismatch. So we talked about that. It's very reflective. So you're going to have the bright white edges or the borders. And then the high attenuation, meaning no sound waves can pass through, you have the anechoic or dark deep to the cortical edges. It has smooth cortical edges or boundaries and posterior acoustic shadowing or posterior reverberation if the surface of the bone is smooth and flat. So this is in sesamoids or calcifications located in close proximity with the bone surface, can mimic cortical breaks. So it's not actually a break, it is an artifact. So we talked about that earlier, why it's so important to know artifacts and where they're seen and how they're created so that you don't say something is broken when it actually isn't. Picture 1 up at the top is from our ultrasound pictures of the carpal tunnel. It shows the pisiform and the scaphoid on the sides, right here and right here, that look like little bone or little domes, and then the rest of the carpal sulcus at the bottom. Picture 2 shows the radius and is a very good representation of the hyperechoic, right here, cortical edges, and the anechoic area deep to it right here. Now we're going to talk about muscle. It's relatively hypoechoic, so dark with hyperechoic fascia. Contracted muscle appears thicker and more hypoechoic, so darker than relaxed muscle. It's separated by fine hyperechoic fibers, which surrounds the hypoechoic dark muscle bundles. In the short axis, it's different. So if you look here, so this is the long axis that we were just talking about right here, the muscle and the fascia. And then the short axis is over here, and it kind of has a starry night-like look. So it consists of small dot-like reflectors interspersed among the hypoechoic muscle fascicles. So here, that starry night look right there, and there. Next up is tendons. They're going to look different in the transverse axis than they do in the longitudinal axis. In the transverse axis, they're going to have multiple hyperechoic or bright clustered dots, tightly packed in a bundle. The synovial sheath that surrounds it, though, is going to be a thin hypoechoic, so dark rim that surrounds this, tendon. Tendon and nerves can be very similar in appearance and size, but tendons are more prone to anisotropy, and they are not normally compressible, and they can demonstrate a little bit more motion. And we'll talk about this later. Longitudinal, they are tightly packed hyperechoic or bright strands, and the continuous tendon fibers can be appreciated in the images, and it's surrounded by this hypoechoic dark signal. The first image up here shows the Achilles tendon from the transverse view with the hyperechoic dots, so all speckled in there. The second image right here is the longitudinal view with the hyperechoic strands all throughout there. And then the last image is just a side-by-side comparison between the two views. So you have longitudinal and that cross-sectional view. So here's the one we're really worried about, nerves. In the transverse or short axis, they are hypoechoic dark nerve fascicles, spots, embedded in this hyperechoic epineurium background. They have a honeycomb, pepper pot, speckled appearance, however you want to think about it, and they're compressible. In the longitudinal axis, they're hypoechoic, dark, parallel linear fascicles separated by these hyperechoic bands. The hyperechoic bands are the interfascicular epineurium, and the hyperechoic fat is typically seen around larger peripheral nerves. When we look at the picture, here is our cartoon nerve. It shows the different connective tissue layers. So you have the fascicle right here, epineurium that's covering it, and then the perineurium that's all around, and then everything surrounding this giant peripheral nerve. In the middle, that's going to be from our ultrasound imaging session of the carpal tunnel. And the median nerve is right here, and it's labeled. You can see it's superficial, and it has that hypoechoic spots embedded in a little bit of a lighter background and a honeycomb appearance. And the next image right here shows the median nerve in a transverse view on the left, and this is what we're going to be looking at when you do your lab session, and it shows the hypoechoic spotting and the bright epineurium. And then longitudinal view on the right with the banding. Now we're going to talk about ligaments. They're hyperechoic, compact, fibular bands. They're more compact than tendons, and they may appear relatively hypoechoic when surrounded by this hyperechoic subcutaneous fat, so it's just a relative thing. They're best evaluated when they are taut. So the image on the right shows a taut anterior talofibular ligament connecting the talus to the fibula with compact hyperechoic bands. Now we're going to cartilage. You have hyaline articular cartilage, and then you have fiber cartilage. So the articular cartilage is homogeneously hypoechoic, so dark, it's a very uniform linear band, and of course it's going to be, on top of bone. So the subchondral bone will appear as a continuous hyperechoic bright line deep to the cartilage band. And you have the picture on the right that shows the tracheal surface of the femur, and the articular cartilage is indicated by the white arrows. And you can see that it's smooth, uniform, and the bone is underneath. So then you have the fiber cartilage. It's homogeneously hyperechoic, so bright, completely different, and it's an adherent to the boner joint. So the echo texture is significantly different from hyaline cartilage because one is dark, one is bright. In the second picture, it shows you the triangular fiber cartilage complex, which has a much different texture than the picture above. Now we get to fluid and bursa. Fluid is going to be anechoic, a black appearance. It can be confirmed with dynamic interrogation as it responds to pressure, so you can compress it. The image on the right shows edema in the calf in the long axis, and you can see all the fluid interspersed there, and it kind of has a cobblestone effect. And it's apparent that the fluid in the muscle is, black in nature, and it would be compressible. Then you have bursa, which is not discernible unless it's distended by fluid. The fluid will appear anechoic between hyperechoic tissue layers of the bursal capsule and the peribursal fat. So the second picture shows the subcutaneous bursa with the top arrow, and then the retrocalcaneal bursa with the bottom arrow, and they both show that fluid in the bursa sac. Next, we have adipose tissue or fat pads. They're hypoechoic dark with hyperechoic bright thin linear septa bands. Intraarticular fat pads appear as hyperechoic bright structures. So the pictures to the right show fat pads around the knee in the longitudinal and transverse view. The fat pad appears hyperechoic instead of the appearance of the subcutaneous fat in the bottom of the picture. So here are the fat pads right here and there, and then again over here. And then over here, this is just adipose tissue, like subcutaneous fat right here. So the last one we're going to talk about is blood vessels. In the transverse or short axis, they're inner hyperechoic bright linear band, which is the blood and the intima. The outer hyperechoic layer is the adventia and the elastic lamina, and then the mid-hypoechoic band between the two hyperechoic layers is the media. So prolonged observation demonstrates a pulsatile structure, you can see it because when you leave the transducer over an artery, you can see it pulsating. You can also compress the veins next to the artery usually with compression of the transducer on the structure. Pulsatility is better appreciated in the short axis during prolonged observation. So the top image depicts the ulnar artery right here in the transverse view, which can be seen pulsating when performing real-time ultrasound of the carpal tunnel. And the bottom image shows blood vessels in the longitudinal view right here. Here's some references for you guys. A lot of these are just some of the pictures. Now it's time to check your understanding. So if you could go to the Module 4 quiz in the Module Quizzes tab of the website,